Sometimes we do blood patches down here. So basically what happens with a blood patch is the patient either had an epidural where the epidural needle poked through the dura and then a bunch of spinal fluids leaking out. Typically the patients that get this, that are get a really bad headache from their spinal fluid leaking out, tend to be low BMI, young females that are at probably highest risk from being most sensitive to that. Other people, like if someone goes for a lumbar puncture in the ER, they use a pretty big needle because they have to drain a bunch of spinal fluid intentionally to test it for meningitis and that kind of thing. So you might see lumbar punctures from the ER, epidurals from OB where the needle goes too far accidentally. Rarely like a spinal that we do for a total joint or something like that, but we use such a small needle that it's very unlikely to get a headache from that. So basically what we do is get them in the epidural position that you saw, and then this is kind of unique for you guys because we inject their own blood into them through an epidural needle. So probably the big thing is it all needs to be sterile when we do it. So we'll kind of be doing the epidural, and you guys will, if they have a good AC vein or something, we'll sterilely prep that, put maybe a couple sterile towels around it. You guys will put on sterile gloves, like drop a butterfly and syringe into the field and sterilely, get that usually about 20 cc's of blood if we can, and then you'll hand that off to us, and then we inject that. So basically, that's the syringe of blood you hand off to us. We push it through the needle, and then the thought is it kind of forms a clot around where the spinal fluid's leaking out, and then that can help their headache a lot. Sometimes people get an instant headache relief or an instant improvement because just the blood kind of pushes some spinal fluid back up. So the thought is they get that hopefully immediate relief, and then they stop leaking out as much spinal fluid because that blood, like I said, will kind of be sticky and stop the CSF from coming out. We don't really inject any medicine or anything like that. So like the hypotension bradycardia from the blood doesn't really happen. I've had some people get vasovagal from it. So that's something to look out for. Sometimes still good to maybe give a small fluid bolus or something beforehand. Risk is that you could poke another hole through the dura and have twice as bad of a headache. And then sometimes if they have really bad veins, you'll get there, we'll kind of be working on the epidural, and we leave you guys with the hard part of trying to find blood somehow without any veins. Then if we can't get it, then we can't get it. Like I said, vasovagal. Really only medicine we give is just a little lidocaine to the skin before we go in with the epidural needle. And I think that's about all I had. Was that everything that